I'm Dr. Rohini Paul. So this is all about nursing skill tips. So today I want to talk to you about the Braden skin assessment. For nurses to see the Braden skin assessment paper and to do the assessment in all these years, I find it is very difficult. So how do you store this in your mind? That is what I'm going to talk to you now. So as you all know, the Braden skin assessment, there are two aspects. One is we have 6 aspects of assessment. So how do you remember these 6 aspects? So I'll make it very simple for you. First level, what do you do when you assess the skin? It is the skin of the patient, how the condition of the skin. So always, is that skin patient has sensitivity is there or not? That is one aspect. Then, if you pour moisture, water on it, is that patient's skin has lot of moisture? It could be with the urine, it could be with fecal matters, it could be sweat. So that is what the second level you will see. The third level, how do you remember? 2 things you can connect together. One is mobility. Can my patient get up from his bed and start standing or walking? Then you connect it with the activity. So the first is skin, second is moisture, the third is mobility of your patient. The fourth aspect is activity. What is the fifth one? It is nutrition of your patient. How do you remember? Connect with the fifth. Think traditionally we Indians eat with 5 fingers. Remember that 5. Connect with nutrition. You can remember that. So the fifth aspect of your Braden assessment should be nutrition. The 6th aspect will be friction. How you are talking about friction? It is does my patient has a tube coming under the bed? Have I provided the alpha bed? Have I provided the proper mattress? Is there lot of wrinkles on my bed sheet? Have I not removed it? So all these are connected with friction. Definitely my patient will have pressure ulcer. So this is what the 6th aspect. My patient will develop pressure ulcer. This I want you to remember. Another 4 things I want you to remember. When you talk about all this for your patient, how good it is. So where you can remember poor, fair, good, excellent. Remember this. Fair, poor, fair, good, excellent. So I am showing you a picture which I made it. Make it very simple. So each aspect you give one number. So this is what it is. Put this 4 aspects of poor, fair, good, excellent. Put that all 6 aspects of what we have assessed. Connect with each one number. For example, my patient, how is his sensation? Is it 1? Then I will call it as poor. If my lot of moisture, if I think it is fair, then I will remember 1 number. Finally, if the nutrition is good, I can think of 3. So when you look at the picture of the scale, you will be able to understand. So you add all these numbers as we always do for Braden skin assessment, come to a conclusion of 1 number. That is what is the score for my patient. With that, how do I know? It is mild, moderate, and severe. That is a scale. So how do I remember that also? Always remember the number 6. So 6, if you make it upside down, you can come to a number as 9. 6 to 9 is very high chance of pressure ulcer for my patient. I'm sure you can remember. 9th, 10th, 11th, 9th standard, 10th standard, 11th standard. It's a very crucial thing in India for all children. I am sure you can remember. That is your high level of pressure ulcer. Remember that. Then the teenage, 13, 14, 15, 16, 17, 18. Remember from 13 to 18 is moderate. So how do you know? If my total number comes between 6 to 9, I say he has a high chance of pressure ulcer, then I should take care very seriously about my patient to prevent pressure ulcer. Between 9, 10, 11, if that score total comes, then I'll say moderate, or you can think of severe. Think of 3 different levels. Then if it is 13 to 18, it's a mild mild severity, so that how do I take care? So this is what it is, the Braden scale. You remember You don't need to take a paper because none of us go with a paper to assess the skin. If you can remember this in a simple way, I'm sure all of you, as soon as you look at your patient's skin, you will be able to assess without the paper in your hand. So I'm sure you understood this. The PPT also will give you more explanation. With that, I'm sure you will be able to do a better assessment. Thank you.